Good afternoon. I am Andrea Chisholm with the Midday News. A special welcome if you're watching on onespotmedia.com. The government has announced it will be taking legislative action to take back Venezuela's 49% stake in oil refinery Petrojam. Minister of Foreign Affairs and Foreign Trade, Senator Kamina Johnson-Smith, gave details at a press briefing this morning. The decision follows failed negotiations with PDVSA, Venezuela's state-owned oil and natural gas company. Mrs. Johnson-Smith explained that Jamaica has made multiple offers to buy back the stake. However, there has been no favorable response. This new thrust comes in the wake of challenges at Petrojam stemming from political turmoil in Venezuela. The Foreign Affairs Minister says it's also part of efforts to protect Jamaica's energy security. And of course, we'll have much more details in primetime news at 7. There's a call for Health Minister Dr. Christopher Tufton to give details on the exact areas being affected by the dengue outbreak. 2 dengue-related deaths were reported in Waterford St. Catherine, but it's argued that not much focus is being placed on that area. TVJ's Shamela Pullen reports.
The health minister reported that over 300 communities are considered vulnerable to dengue, as there have been reports of increased mosquito breeding in those areas. However, it did not say the specific areas that were affected. Now, opposition spokesman on health, Dr. Dayton Campbell, is insisting that in St. Catherine alone, there have been 187 dengue cases, 40% of which were in December last year. This has raised concerns, especially for Member of Parliament for St. Catherine Southeastern, Colin Fagan, who says there were 2 recent dengue-related deaths in the Waterford area.
A 4-year-old just over the weekend. I think it was a 9-year-old prior to that. In that area, we have a primary school, infant school, about 5 basic schools, a high school, and in close proximity to that, we also have the Hart Construction College and the Portmore Community College. So in a concentrated area.
Mr. Fagan notes that as part of the government's response to the dengue crisis, the health minister has announced the extension of opening hours at specific healthcare facilities until 8 p.m. for persons who have dengue symptoms. However, the MP says nothing has been announced for the Waterford Health Clinic, where he says he's been getting a number of complaints.
I think that there's need for more work from the ministry to help the people in the community to understand the danger of the disease. But outside of that, the truth is that people are very concerned. They are not too sure how to handle themselves.
Despite the suggestion that what has been done is adequate, even now, you don't know and we don't know where are the areas in the country that dengue is most concentrated. If you ask yourself that question, where are the communities in the country that dengue is more concentrated, and what are the measures that has been put in place in those communities? Do you know that? We have not been told.
Shamela Pullen, TVJ News.
And in response to the dengue outbreak, the National Solid Waste Management Authority, NSWMA, this morning started an island-wide drive to remove bulky waste from several communities. We caught up with a team in New Haven, St. Andrew.
There you see a old refrigerator, deep freeze. It may seem like it's not a problem, but the truth is it has the capacity to contain water. There's a paint can that was beside it, filled with water. Those are the little things that mosquitoes breathe in, and then it creates a problem like dengue.
NSWMA Executive Director Audley Gordon says the Ministry of Health is funding the cleanup drive. There was a major cleanup at the back of one house, which was a haven for the disease-carrying pests.
And look at them, I breed the dengue mosquito them. So they need to come out. All of them. From the one that go right back to the one that almost to the one them on the ground. Having mosquito and water.
The NSWMA is reminding residents to keep their surroundings free of mosquito breeding sites. Meanwhile, Health Minister Dr. Christopher Tufton says the ministry is working with the staff complement at public health facilities. He was responding to concerns from the Nurses Association of Jamaica NAJ that the outbreak of dengue fever could put a further strain on its members. NAJ President Carmen Johnson said some nurses have been working double time to attend to patients. Speaking on TVJ's Smile Jamaica program this morning, Dr. Tufton reminded persons that the flu season coincides with the surge in dengue cases.
That we have not built a hospital in Jamaica for the last nearly 30 years. We have an old infrastructure and we are making do with what we have. I think the clinicians are working very hard. They make themselves available, and what we have to do is to manage the process. So yes, I am prepared to admit and accept that we do have overcrowding, particularly in these times. But what we do, we shift persons around, move from one hospital to the next. In the case of Bustamante Hospital for Children, our children are particularly vulnerable because their immune system to the dengue virus, to the environment, is not as mature.
As ours, right.
And so that is a particular institution that is affected. So we have transferred persons to UWI. We have been working with the Chest Hospital, with the St. Joseph's Hospital, and it really is a case of logistics management of the process.
He has also lauded the call from opposition spokesman on health Dr. Dayton Campbell for persons to donate blood. And the health minister says the health and education ministries will be monitoring the implementation of the sugary drink restriction to determine whether interventions are needed. Vendors at some schools are yet to adapt to the changes, while some students say the additional cost is a challenge. TVJ's Shamela Pullen has details.
It's the second day since the sugar restrictions in schools have taken effect, and so far the response from some schools have been positive, with the exception of vendors. However, principal at Maypen Primary School in Clarendon, Captain Paul Scott, says vendors there will be closely monitored by the institution's safety and security team for any breach.
We have informed them long time ago, and they are on board with us, so we will just monitor to make sure that they do not breach this implementation as outlined by the government.
Captain Scott says it's a technical process that takes time, but the school will do whatever it takes to adapt to the necessary changes.
On the nutrition facts, on the bottle of juices and so on, we can see whether or not there are too much or too little sugar in the juice that we drink. We just need to know the amount of sugar that needs to be in it, and then we look on the nutrition facts to see if that amount is in it. If that amount is not in it or too much is in it, then of course we have to find an alternative.
On Monday, Health Minister Dr. Christopher Tufton toured the Manchester High School to observe the implementation of the policy. Dr. Tufton says he's impressed that most students in the cafeteria were drinking water. But some students complain about the additional cost to purchase healthier drinks.
It's a good initiative, I must say, but some of the new drinks that are recommended, they are a bit more expensive. So yes, that's the only issue.
Some students usually lean to the more sugary drinks just because of the cost, and that's a real problem that should be handled properly.
For now, it's really about using moral suasion, guided by the policy, based on a recognition that we hope all Jamaicans will realize and accept, that it is in the interest of all of us to protect our children and give them the best opportunity for learning and for developing in a healthy way. And this is a start, we believe, of a shift for the better that ultimately over the medium to long term will lead to a healthier nation. And
Shamela Pullen, TVJ News.
Meanwhile, the opposition spokesman on health, Dr. Dayton Campbell, has thrown his support behind the health ministry's efforts to ban sugary drinks in schools. Dr. Campbell, however, has one concern.
What I don't want is for the minister to make a policy without putting the alternatives in place. For example, when it was just announced, we were told that they're going to take Nutribulla out of school. And in my own constituency, in a few weeks' time, the very thing that was delivered to the school was the Nutribulla. It was delivered to them with water. So that is the concern, that you put the necessary alternatives in place. So meet with the manufacturers, ensure that they develop these products, that you can have them to nutrition products to deliver in the school.
And the Health Ministry says it will be holding a series of workshops to help small manufacturers such as bag juice producers to comply with the sugar content restrictions. Director of Nutrition Services in the Ministry, Charmaine Edwards, says it will be collaborating with the Scientific Research Council.
I had consultations with medium-sized bag juice vendors as well. We met with them. The Ministry of Health, we have a number of plans for the smaller manufacturers, especially who need to reformulate. We're going to be working with the Scientific Research Council to have workshops for these smaller manufacturers and just helping them to reformulate their products. I know the Ministry of Education.
In news overseas, German far-right politician Frank Magnitz has been beaten unconscious in an attack in the center of the northern city on Monday. Police say the attack was politically motivated. The leader of the Alternative for Germany party was attacked by 3 men wearing masks. Mr. Magnitz was beaten with a piece of wood and kicked in the head. He was later rescued by a construction worker. Mr. Magnitz had just left a New Year reception at an art museum when he was attacked. And in sports, acting chairman of the Jamaica Racing Commission, JRC, Clovis Metcalf, says any jockey found guilty of breaching the JRC rules as it relates to using an electrical device or a battery on horses will be severely punished. Metcalf's statement comes in the wake of allegations that an unnamed apprentice was caught with a battery in his possession at the park at the Caymanas Park. An investigation was started by the stewards and preliminary statements were taken. A hearing is set for later this week, and punishment, Metcalf says, will be meted out based on the evidence presented.
It is within the purview of the Commission once the matter has been heard. But it could be a suspension for a number of years, as well as it can be complete warned off.
He added that the JRC wants to make it clear that such practices are unacceptable in the racing industry, and if found guilty, a strong message will be sent. And that's the Midday News. I'm Andrea Chisholm. Join us at 7 for the Primetime News Package. On behalf of the news, sports and production teams, good afternoon.